Hello, and welcome to ABCT Fact Sheets. My name is Nicole LaPlena, and I am a clinical psychology graduate student. I will be reading the fact sheet on sexual assault. ABCT fact sheets are created by a team of interdisciplinary experts. Please see the link provided in the video description for more information about the team behind this fact sheet. Sexual assault. Anyone, including men, women, and even children, can be sexually assaulted. Sexual assault is usually defined as sexual activity between two or more people in which one of the people is coerced or threatened with harm. The sexual activity may include fondling, sexual intercourse, oral sex, and/or anal sex. The sexual aggressor can be a family member, like a husband or father, or a friend, date, acquaintance, or stranger. What is sexual assault trauma? Sexual assault is a crime that has become an epidemic problem. Sexual assault can be an extremely stressful, terrifying event and can severely disrupt the survivor's lifestyle and coping patterns. During a sexual assault, the survivor has to deal with feelings of powerlessness and uncertainty about whether he or she will survive. Frequently, the survivor's life is directly threatened, and the survivor may be physically injured in a variety of ways. At the same time, the survivor must remain alert, trying to protect himself or herself from even more harm. Children who may be present are often threatened, adding to the terror and causing the survivor to feel responsible for protecting them. Studies show that the impact of sexual assault varies from person to person. Survivors may no longer feel safe, may lose self-esteem, feel powerless, and lose the ability to trust others or develop intimacy. The more terrifying the assault, the more the person's life is threatened, and the more problems survivors usually have afterwards. Having suffered previous traumas can also contribute to greater problems. What are the problems? After a sexual assault, survivors can experience a range of responses. However, some patterns are especially common. Survivors often report that they have repeated and frequent memories of the sexual assault that intrude on their thoughts and can't be controlled, flashbacks, or a feeling like they are reliving the sexual assault, nightmares, and difficulty sleeping. In addition, sexual assault survivors may experience feelings of being on edge, having trouble concentrating, feeling the need to continually watch over their shoulder, or being easily startled. Survivors also report that they tend to avoid reminders of the sexual assault, including avoiding places that may resemble the place where they were assaulted, may feel less interested in things that they used to enjoy, and may feel emotionally numb. Survivors may also withdraw from social interactions or settings. When these problems persist and disrupt daily life, mental health professionals call this group of symptoms PTSD or post-traumatic stress disorder. In addition to PTSD, sexual assault survivors frequently find that they feel depressed and hopeless about the future, which can lead to thoughts about suicide. Many survivors also report that they feel like the sexual assault was somehow their fault, resulting in feelings of self-blame and self-doubt. Frequently, sexual assault survivors also say that they feel generally unsafe and often have difficulties with trust and intimacy. It is also common for sexual assault survivors to have questions about their physical health and develop problems related to their sexual functioning. Lastly, sexual assault survivors may resort to using drugs or alcohol to cope with their symptoms. Can therapy help? Yes. Several short-term therapeutic techniques have been shown to effectively reduce the PTSD symptoms. Although symptom response to the assault may vary from person to person, effective short-term treatments are available for PTSD and a variety of disorders that tend to be part of PTSD, including depression, panic, anxiety, and phobias. Regardless of a survivor's specific symptoms, treatment should include two basic components. 1. The development and maintenance of a trusting relationship with a therapist, and 2. The recounting of one's story about the assault and treatment so that the therapist can help the individual overcome the debilitating symptoms resulting from PTSD. Telling one's story allows survivors to feel more in control of their memories and the feelings that have arisen in response to them. PTSD symptoms do not tend to go away by themselves. The earlier survivors begin therapy, the sooner they can begin addressing symptoms and turning their lives around. In behavior therapy, the therapist helps survivors make sense of their memories. Although the memories will never be pleasant, the psychological pain and anxiety associated with them can be reduced. Therapists may also diminish the power of the memories or flashbacks by having the survivor relive and re-experience them. Medication may be appropriate as an adjunct to behavior therapy for some survivors of sexual assault, primarily for individuals who are having a difficult time with PTSD-associated depression. When used in conjunction with behavior therapy, antidepressants have been found to be an effective tool in reducing trauma-related depression. Survivors of sexual assault should not suffer in silence. Behavior therapists offer effective treatments tailored to a survivor's individual problems.